The main goals of our study were to show if we could shorten the time to neutrophil engraftment, the time to platelet engraftment, the incidence of bacterial, fungal, and viral infections, and also to show if there was any advantages in the 100 days alive and out of hospital of the patients transplanted with Omidubicel. And we achieved those goals. Thus, we believe that Omidubicel should be, after this trial, the standard of care for patients who need a cord blood transplant. We were able to demonstrate that Omidubicel was capable of allowing a 100 to 130 expansion of the CD34 positive cells in the graft. And in the end, the median number of CD34 cells infused to the patient with Omidubicel was 9 per 10 to the 6 per kilo, whereas it was only 0.3 per 10 to the 6 per kilo in patients receiving standard cords. And I would like to stress that this number of stem cells that are given in a transplant that is expanded with Omidubicel is greater than the one achieved with both bone marrow and peripheral blood transplantation from an adult donor. And we hypothesize that if we were able to achieve these very high numbers of stem cells in the graft, we could reduce the time to engraftment in patients receiving cord blood transplantation. And that was the case because patients receiving Omidubicel had only 12 days to neutrophil engraftment compared to 22 days in patients receiving a standard cord blood transplantation that in 2/3 of the cases was a double cord blood transplant. And it was the same for platelet engraftment, and we were also able to show a 20% reduction in the number of bacterial and fungal infections in the 100 days after transplant, and also in the days alive and out of hospital in patients transplanted with Omidubicel. That was 61 days versus 40 days for patients receiving the control transplant. And we are very satisfied with the results of this trial, and we believe that Omidubicel will receive a very fast approval by the FAD and the EMA regulatory agencies.